কোন রাষ্ট্রের আইনসভা দ্বিকক্ষ বিশিষ্ট? যুক্তরাষ্ট্র, ভারত, যুক্তরাজ্য। উপরের সবগুলো। কে প্রথম গ্লোবাল ভিলেজ ধারাটির উপস্থাপন করেন? হারবার্ট মার্শাল ম্যাকলুহান। ইসমাইল হোসেন সিরাজির কোন কাব্যটি বাজেয়াপ্ত হয়? অনল প্রবাহ। শ্রীকৃষ্ণ কীর্তন কাব্যের প্রথম খণ্ডের নাম কি? জন্মখণ্ড। ইউসুফ জেলাকার কবি শাহ মোহাম্মদ সগরের জন্ম কোথায়? চট্টগ্রাম। আজ 4 দিন হতে দৈনিক শোষকারী জাত কার লেখা? কাজী নজরুল ইসলাম। হোয়াট টাইপ অফ সেন্টেন্স ইন ডু অর ডাই কম্পাউন্ড in acute inflammation pain occurs due to histamine. A skeletal mouse skull is present in the following viscera. The diaphragm. The diagram. What is the critical post operative instruction for a patient with new restoration? Avoid sewing on the restoration until anesthesia wears off. Morphine is contraindicated in acute MI. Bite mark analysis is most commonly associated with criminal investigations and assault cases. What does the principle of non-maleficence mean in dental practice? Do no harm. Which one is maxillary antral pathology? Nasal polyp of antral lining. In TMJ ankylosis, there may be micronetia. Which of the following drug acts by inhibiting nucleic acid synthesis? Metronidazole. Regarding the caries and pulpitis, acute closed pulpitis causes dull pain at night. Several facial colitis causes base of tongue fast back blocking the airway. The best dimensional stability among elastomers is addition silicon. Risk factor or wound infection is poor perfusion. Which concept of health emphasizes the ability to accomplish the social rules and responsibilities? Holistic. Which one is true for hyperplastic gingivitis? It is often associated with long-term use of drugs like phenytoin. Which of the following factor causes collapse of the lung? Negative intrapleural pressure. What is the primary mechanism by which fluoride prevents dental caries? By promoting remineralization and inhibiting demineralization. Knopf, Rockwell, Vickers, Brenel tests are done to measure materials hardness. Which lesions show Hubble appearance on radiograph? Odontogenic keratocyst. Which lesions show bubble appearance on the radiograph? Odontogenic keratocyst. Implant joint with bone is called osseointegration. Finishing of glass enamel restoration is done after 30 minutes. Marshallization of jaw cyst applies in a very large cyst with a sense of bone fracture. Which one is not oral specific ulcer or lesion? Chronic hyperkeratosis in battle sure. Which one is an allergic reaction in facial area only? Angioneurotic edema. Which one is correct? CT scan with contrast is good for oral cancer and neck nodes studies. Which informed consent is legally required in dentistry? Explanation of risks, benefits and alternatives before treatment. Which one is true for alveolar bone fracture? Splinting is quite useful. Main reason for endodontic failure: poor access, safety, preparation. The most critical aspect in designing an oral health education program for rural communities is culture and literacy. What is the common cause of tooth sensitivity after restoration? Use of high speed handpiece with less irrigation. Syncope relates to cerebral hypoxia. Cell rich zone of FOF contains fibroblast. Alveolar group of periodontal fiber enclose. Interradicular group. In regenerative endodontics, recommended irrigation protocol is NaOCl plus EDTA. Myocardial infarction will lead to increase in serum level of flowing enzyme creatine kinase. Mental nerve block and anesthesis lower lip. Acute odontogenic pain is caused by acute closed pulpitis. In chronic osteomyelitis, sequestrectomy needed. True adhesion occurs in the flowing materials with tooth structure. Polycarboxylate cement. Effective treatment of open bite is orthodontic labial bow. Effective treatment of open bite is orthodontic labial bow. Which cell is decreased profoundly in case of AIDS? CD4 lymphocyte. Alveolar bone is an immature type of bone. In full denture, postdem is important for good retention of upper denture. The property that makes acrylic resin suitable for denture bases is lightweight and easily moldable. Which of the following is a mass level approach for preventing both dental caries and periodontal disease? Oral health education and awareness programs. Maximum tooth tissue reduction is needed for PMF crown. Which organism can cause infective endocarditis after dental procedure? Breedens Sophie. Which organism can cause infective endocarditis after dental procedure? Breedens Sophie. In sterilization, cotton can be sterilized by autoclave. Which one is true for Physencharus lesion? Arthrophilia is more prone to develop cancer. Which one is true for jaw benign tumor? Multilocular ameblastoma is more common in mandible. Feather of plasma leakage in dengue fever is narrow pulse pressure. What is an appropriate approach for managing deep caries close to pulp? Indirect pulp capping. Odontogenic tumors are well managed by excision. Pericoronitis of third molar gum can cause tongue edema. Stainless steel loses its resistance to corrosion if heat to a high temperature due to precipitation of chromium carbide. Time dependent flow is known as creep. MTA is used for affixogenesis of any denition. Fillers are added to composite resin to increase oil resistance. LE4 fracture causes elongated face. Facilitated diffusion is a downhill process. In metabolic acidosis, compensation is by hyperventilation. Which one is true for dental implant? CBCT can give a better idea about bone quality. Non-odontogenic cyst is incisive canal cyst. Which one is correct for TMJ disorder? Disc displacement. The key limitation of field service in rural dental health program is poor diagnostic accuracy. Fast format and mineralized dent is Fredentin. Body water is regulated by ADS. In trigeminal neuralgia, pain increases with cold touch. Which of the following reaction takes place in face I? Biotransformation. Hydrolysis. Which one is true for congenital facial cleft? Repair of depth plate at age of 12 months. In oral malignancy, excision is useful in carcinoma in situ. Cellular cementum is found in apical 1/3 of root. The cause of improved earlier strain in resin modified glass ionomers is light activated resin polymerization. Most important property required for dental implant is biocompatibility. Content of internal are includes semicircular canal. Curve of SP is used for balance occlusion. Symptom of acute myocardial infarction is shortness of breath. Hypomineralization structure of enamel is enamel lamella. SIB is usually transmitted through infected blood IV injection. In hypovolemic shock, start with any IV influent. For the designation of illusion impression, one is commonly used. 2% glutaraldehyde. Which of the following agent is used with Zingbal reaction called aluminum chloride? Stratified squamous epithelium is located in oral cavity. Which sterilization method is not recommended for spore containing instruments? Ultraviolet radiation. Which one is not a dental emergency? Alveolar osteitis. Alveolar osteitis. In case of Laros chronic oroantral. In case of Laros chronic oroantral fistula. Food accumulates into maxillary antrum leading several dental bleeding. Haploid number of chromosomes are present in spermatid. In cause of oral bleeding, B-cell ligation is important in excessive bleeding. Which of the following is primarily lymphoid organ? Lymph node. Baroreceptor feedback mechanism decrease blood pressure is vagus nerve. Which one is cause facial pain? TMJ disorder. Recommended maximum dose of 2% lidocaine with adrenaline is 7 mg by kg. Adrenaline in local anesthesia causes less bleeding surgical field.